Hello everyone, this is Sharmia. In this video, we are going to see about what is meant by hypertension. First of all, hypertension, how we will measure hypertension is based on the blood pressure. If the pressure is more than 120 bar 80, it is considered as a hypertension. If the BP is less than 110 bar 60, it is considered as a hypertension. In this we are going to see about what's meant by hypertension. First of all, in this video we are going to see what are means definition, types, risk factors, clinical manifestations, management. First of all, definition, what is meant by blood pressure. Blood pressure means is a force exerted by the circulating blood against the walls of the body's arteries, the major blood vessels in the body. Hypertension is when blood pressure is too high. Yes, blood pressure means it's a force exerted by the blood. If the blood force is increased, means it is considered as a hypertension. In which are condition it will be increased means if there is any block, means if there is any block in the arteries, means the blood cannot pass. During this time only the blood pressure will increase to by increasing the pressure only the blood can reach the other part, so that it will increase the pressure. During this time only the hypertension will be experienced. Hypertension is also known as it's a high blood pressure. It's a long-term medical condition in which the blood pressure in the arteries is constantly, there will be elevation in the blood pressure during a long period of time. It is considered as a hypertension. Hypertension is a platform for major diseases like heart diseases, kidney diseases. These are diseases. For these are diseases, hypertension is the main reason. Next one, normal. There are two types: systolic blood pressure, diastolic blood pressure. Normal systolic blood pressure is less than 120. Normal diastolic blood pressure is less than 80. Pre-hypertension, starting stage of the hypertension, 120 to 139, the systolic pressure will be. 80 to 89, the diastolic pressure will be. Stage 1 hypertension, the blood pressure will be 140 to 159. In diastolic, the blood pressure will be 90 to 99. In stage 2, the blood pressure will be more than 160. Systolic blood pressure will be more than 160, and diastolic blood pressure will be less than greater than 100. Next types, there are several types. The first one is primary hypertension. It's also known as an essential hypertension. Most adults will experience this type of hypertension. It starts to be the combination. Its etiologies, main causes is genetics, diet, or lifestyle, or physical changes. Lifestyle factors include smoking. Smoking is one of the major risk factor for hypertension. Drinking too much alcohol, stress, overweight, eating too much salt, and not doing any exercises. These are the reasons for the primary hypertension. Next one is secondary hypertension. It's where there is an identical and potentially it's a reversible cause of hypertension only. Some 5 to 10% of the patients will experience this type of hypertension. The underlying causes will be the narrowing of the artery. Narrowing of the artery, blockage in the arteries are side effects of the medications, diet, stimulants, antidepressants, OTC medications, sleep apnea, obstructive sleep apnea, hormonal abnormalities, thyroid abnormalities. These are the main reasons for this secondary hypertension. Next, risk factors include unhealthy diet. eating too much fat-rich foods, junk foods, physical inactivity, not doing improper exercises, obesity, too much alcohol, genetics, family history, tobacco, smoking, age is a non-modifiable risk factor, stress, chronic conditions, kidney diseases. These are the major reasons for the hypertension. Clinical features, major signs and symptoms. Sometimes the high blood pressure does not cause any signs and symptoms because it's a silent killer. In some patients, it will include severe headache, blood vision, dizziness, tiredness, nausea, vomiting, fatigue, shortness of breath, irregular breath. Um, these are the major signs and symptoms for hypertension. Then management, there are two types of management: non-pharmacological, pharmacological. Non-pharmacological means the my lifestyle modifications mainly includes we should maintain a proper healthy weight, reduce the salt intake, increase the physical activity, doing proper exercises like walking and all. Tobacco, smoking, avoiding smoking and tobacco consumption. Alcohol consumption also we should limit it. Fat intake, the fat intake also we should limit the fat intake. Then control the diabetes. If the patient is diabetic means we should take the proper medications to control it, otherwise it will leads to other chronic conditions like kidney disease, heart disease. And pharmacological management includes diuretics. Diuretics, it will high sodium levels will increase the excess fluid in our body, which can also increase the blood pressure. So diuretics is also called as the water pills. It will help to reduce the remove the waste water. Remove the excess sodium. So following the sodium, water will also excreted. As the sodium needs extra fluid in our body also moves into your urine, which helps to reduce the blood pressure. Next, thiazides. Thiazides are used in uncomplicated conditions, mild to moderate hypertension. Until we can use the thiazides, it has a long duration of action. Mainly, the drug is given in dose of 12.5 to 25 mg per day. Examples includes chlorothiazide, hydrochlorothiazide, chlorothalidone. Its mechanism of action is the thiazides will inhibit the sodium chloride symbiote in the distal convoluted tubule. It will promote the sodium excretion. Then water will falls the sodium. Then it will also decrease the cardiac output. Like this way, it will decrease BP. Yes, decrease the sodium, so that sodium is followed by water is water. Sodium is followed by water, so that sodium excreted, water is also excreted from our body. In this way, excess water will be reduced, so that it directly reduces the blood pressure. Advantages of thiazides: it has a long duration of action, cheap, and has synergistic effect when used in combination with other anti-hypertensive drugs. Adverse effects: hypokalemia is um, decreased potassium level, hyperuricemia, hypercalcemia. Next one is potassium sparing diuretics. They are usually given with thiazides to counteract potassium. Yes, potassium loss, to prevent potassium loss, it is given with the thiazides, and it has increased the antihypertensive efficacy. Use of AC inhibitors with thiazides decrease the potassium loss by thiazides and enhance the antihypertensive effect. Yes, for reducing the potassium Last, we will give potassium sparing diuretics along with thiazides. Example, triamterone and spironolactone. Pharmacokinetic actions will include it's given in oral route of absorption and low volume of distribution. Main uses is in hypertension and hypokalemia. Next one is loop diuretics. This drugs has a short duration of action. As a, as a sustained sodium deficient is not maintained. Therefore, they are not routinely used hypertension except in the presence of renal or cardiac failure. If the patient having renal or cardiac failure means this loop diuretics is used. Example, furosemide and torsemide. Its main area is adverse effect is low sodium levels and too much potassium levels in blood. Next, hyperuricemia. Yes. Diuretics. There are three main types. First one, loop diuretics, thiazides. Next one, potassium sparing diuretics. Furosemide, loop diuretics, furosemide, thiazide, hydrochlorothiazide. Next, potassium sparing, triamterone and spironolactone. They act in the nephrons, certain parts and increase the sodium output. In this way, it increases the urine output, increased urine output, so that there will be a reduction in the water, reduction in the excess water. In this way, low BP is caused. Next one is AC inhibitors, angiotensin converting enzyme inhibitors. Main angiotensin is a chemical. It causes the tightening and narrowing of the blood vessels, so that by compressing it, the pressure is reduced. AC inhibitors prevent the body from producing so much of this chemical. Yes, by tightening and narrowing only, our blood pressure will be increased, because it cannot pass through the other part of the other part area. So when we give angiotensin receptor converting enzyme inhibitors, it will helps the there will be no tightening, so the blood vessels will relaxed and automatically the blood pressure will be reduced. Say renin-angiotensin aldosterone system. Angiotensin is renin inhibitors is renin in renin only convert the angiotensin into angiotensin 1. Next AC inhibit next angiotensin 2, it converted in the lungs, and it will compress the blood vessels. But when we give AC inhibitors, it will block the conversion of angiotensin 1 to angiotensin 2, and prevent relax the blood vessels and reduce the BP. AC inhibitors example, captopril, enalapril, lisinopril, ramipril, etc. Renin inhibitors include aliskiren. It will helps to prevent the conversion of angiotensin to angiotensin 1. So that also will be reduced BP. Pharmacokinetics, angiotensin converter enzyme inhibitors are usually given in the orally. In emergency, enalapril can be also given in the intravenously. Food reduces the absorption of the captopril, so it should be given 1 hour before the meals. Its inhibitors poorly cross the blood-brain barrier, so it will not affect the brain, and it is mainly metabolized in the liver and excreted in the urine. ADR dry cough is due to the increased bradykinin levels in the liver. Okay. Angioedema, swelling of the nose, lips, mouth, throat, larynx, glottis. They are the they can be there can be airway obstructions in patients also. Next, teratogenic effect. Next, angiotensin 2 receptor blockers. It aims to stop the creation of angiotensin. This blockers block angiotensin from binding with the receptor. Without the chemical, blood vessels won't tighten. Yes, without the main chemical, the blood vessels will not tighten. The blood vessels will become relaxed, and therefore the BP also reduced. Two types of angiotensin 2 receptors are angiotensin 1 and 2. Most of the effect of angiotensin 2 are mediated by angiotensin 1 receptor. They are vasoconstriction. Angiotensin 2 receptor is. This will competitively inhibit the angiotensin receptor blocker will inhibit the angiotensin 2. 2 angiotensin 1 receptor subtype and block its effect. It will produce effects that is similar to the angiotensin converting enzyme only. It will does not produce any bradykinin production. So, example losartan, valsartan, candicertan. Their ADR are hyperkalemia, increased potassium level, hypertension, angioedema, swelling of skin due to the fluid buildup. Next, nausea, vomiting, teratogenic effect. Uses are hypertension cases, cardiac failure cases, myocardial infarction cases, diabetic nephropathy. Next one is direct renin renin inhibitors. This we can we saw aliskiren. Aliskiren will block the renin, which is used to convert the angiotensinogen to angiotensin 1. For major example is aliskiren. It is useful in hypertension in combination with diuretics. We can give in combination with the diuretics. It is administered orally. Major areas are diarrhea, abdominal pain, angioedema. Next one is vasodilators. These medications will directly act on the muscles in the walls of the arteries, and preventing the muscles from tightening and arteries from narrowing. Muscles only tighten will block the blood, so that hypertension causes. But here vasodilators, muscles get relaxed. It will prevent the muscle tightening. Example, nitroglycerin and sodium nitroprusside. ADR, rapid heartbeat, tachycardia. Next, heart palpitations. Next, beta blockers. Beta blockers, many examples there. Adenella, metoprolol, selective beta blockers, non-selective labetalol, labitella, carvedilla. Adenella and metoprolol will decrease the cardiac output. There it will also reduce the cardiac output and decrease the smooth muscles. It will also reduce the renin, angiotensin 2, aldosterone. By this, it will reduce the BP. Next one is calcium channel blockers. This medications block some of the calcium from entering into the heart muscles. This will lead the less forceful heartbeat and low the BP. These medications also work in the blood vessels also, causing them to relax and further lowering the BP. Example, amlodipine, verapamil, diltiazem. Major use hypertension, pectoris supraventricular arrhythmia. Here is calcium channel blockers, dihydropyridamines, calcium input is blocked, so that reduced calcium input, so that workload in the heart also reduced. So in this way, BP also reduced. Example, amlodipine, felodipine, nicardipine, nifedipine. Non non-hydropyridamines is nicardipine and nifedipine. They decrease the contractibility, decrease the heart rate, and to decrease the conduction. In this way, it will reduce the BP. Okay, in this video, what we have seen is what is meant by blood pressure, what is meant by hypertension, and what are the major normal values and types of hypertension, risk factors, main signs and symptoms, management. There are two types: non-pharmacological, pharmacological. In pharmacological, we can say diuretics, thiazides, potassium sparing diuretics, loop diuretics, AC inhibitors, next angiotensin 2 receptor blockers, direct renin inhibitors, vasodilators, beta blockers, and calcium channel blockers. There are several drugs based on the patient condition. The dose is adjusted and the drug is selected, and combination drug is selected based upon the patient conditions. That's all. Thank you.